I'm Joseph Coselli. I'm with Baylor College of Medicine and the Texas Heart Institute in Houston. Some people ask me if I've lived my whole life in Houston, and all I can do is tell them, not yet. I've had the honor and privilege of being trained by Dr. DeBakey and Dr. Stanley Crawford, who I was an associate with for 7 years prior to his stroke, which ended his career. I got to know Dr. Cooley when actually I was a youngster, because we were both Houstonians, and so it was a completely different kind of relationship. What we've learned from all of our mentors, including Dr. Ted Dietrich, who was a pioneer in the endovascular techniques, is that in dealing with complex patients with arterial and aortic and even cardiac problems, the more tools that we have in our armamentarium, the better. So it's attributed to Mike Tyson a lot, but actually it was from I believe it was an Austrian general many years ago. He said, every battle has a plan until the first shot is fired. So I think we have to be quite flexible as how do we approach things. You have to have a basic plan to start with, but you have to have in your mind plan B, plan C, plan D, and be able to implement those depending upon what happens, what you identify, how the pathology presents itself. Even with the best imaging preoperatively, we still encounter issues, endovascular as well as in open surgery, that are not exactly precisely defined by the preoperative imaging. And so to be able to have many different approaches to a given situation is what allows us to manage patients and have a successful result. The other thing that's extremely important is to follow our patients, to keep our own registries, have a database on our patients, and review that on a regular basis. You don't want to make a decision based on your last patient. You want to make a decision based on your experience with many patients over a number of years. So that's just a few ideas of some small advice that I might give.